I was taking Introduction to Psychology as a first year. My professor shared a staggering statistic with the class. 1 in every 2 people are expected to experience a clinically significant mental health disorder at some point during their lifetime. This is an experience that hits close to home for many. Maybe for you, someone you love, a classmate or colleague. And if nobody else, now you know me. So many things drew me into studying psychology, and one of them was my own lived experience of mental health challenges. My personal trio of terrors: health anxiety, depression, and existential dread. They'd long been familiar companions, and prolonged and unexplained challenges with my physical health last semester only made them rage harder. It took me months of trial and error to finally tame the physical symptoms and the trio of terrors. And they still sometimes come back to bite me at the times I least expect. And yet, I am one of the lucky ones who had the support and care that I needed to thrive despite my challenges. Mental health conditions are one of the world's leading causes of disability, causing immense amounts of personal, vocational, and societal distress. And according to the World Health Organization, suicide claims 1 life globally every 40 seconds. Although we're making strides in understanding mental health conditions, it's clear that current care models are woefully inadequate for addressing the needs of so many people. Today, I'll be highlighting actionable reforms to mental health care at all levels of society, from the individual to the mental health field to broader society. My hope today is that regardless of your personal or professional background, you'll see yourself somewhere in my talk. I'll be using this reverse pyramid model to share my ideas today, starting from the most specific changes and gradually building up to the most global. Let's start with the obvious. Training more mental health professionals could help people to access care. In 2023, nearly 40% of psychologists had a wait list for new clients, and psychologists predict that this demand will only rise over time. Reforms to the mental health care system could help to draw in new providers into existing master's and doctorate level career pathways, and create new roles for lay counselors at the bachelor's level. Master's and doctorate level clinicians currently in the field face a number of challenges related to their professional training and careers, including financial barriers, intense time commitments, and emotional burnout. The busiest clinicians may see upwards of 7 clients a day. And due to the low compensation rates and bureaucratic demands associated with joining an insurance panel, many clinicians find that they cannot be in network with insurance while meeting their own personal needs. There are solutions that could help to ease these challenges. Universities could provide more extensive scholarships and stipends for qualified students, particularly those at the master's level, who currently have to pay out of pocket for their education and training. Insurance companies could increase reimbursement rates, allowing providers to make a fairer living while serving those who couldn't otherwise afford care. And finally, specialized clinical training programs can certify lay counselors at the bachelor's level to provide low-intensity talk therapy to clients experiencing mild to moderate emotional distress. A successful example of such an initiative is the United Kingdom's Improving Access to Psychological Therapies program, which currently provides over 1 million people with access to care annually. Bachelor's level clinicians can free up space in the caseloads of clinicians with higher levels of training to serve the needs of patients with more complex or enduring challenges. If you're thinking these solutions sound too simple, you're right. These solutions require buy-in from broader institutions, such as universities and insurance companies. They also require a broader reduction in social stigma surrounding mental health, which is a huge barrier to people's willingness to seek out care. And finally, if bachelor's level clinicians were integrated into the picture, prospective clients may have doubts about this newer and less established care model. To be truly effective, these changes require broader, public-facing education beyond the mental health field. The K-12 education system is a currently undertapped, but potentially hugely influential player in increasing mental health literacy and decreasing stigma in the general population. Imagine a standardized mental health 101 curriculum, integrated into required K-12 health education classes. Just like students learn about the benefits of exercise, nutrition, and sleep for maintaining their physical health, they could likewise learn evidence-based coping strategies for dealing with stress and interpersonal conflict. Teachers could highlight explicit parallels between physical and mental health to decrease mental health stigma and suggest signs that might suggest a need for more intervention. And finally, these programs can highlight the breadth of available care options for varying levels of need, including lay counseling and clinical mental health care. However, even these solutions don't fully fill the gaps. Development of effective, evidence-based mental health education protocols takes years, and currently existing protocols still need further refinement. Additionally, because schools have such unequal access to resources in general, the delivery of mental health education could vary widely from school to school. And finally, students may have a difficult time focusing in a mental health-related class due to other, more pressing concerns, such as worries about passing another class, family challenges, and personal challenges. Which brings me to possibly the biggest challenge of all. Individual mental health is inseparable from its broader societal context. In 2024, nearly half of surveyed Americans reported living paycheck to paycheck. Far too many experience homelessness, poverty, and food insecurity. Some additionally face identity-based discrimination on various facets of personal identity, which also has a prolonged and detrimental effect on mental health. Social media, while potentially a useful tool for relationship building, is paradoxically associated with increased isolation and loneliness. I have only named a fraction of the societal challenges that affect individuals around the world. And yet, these challenges have a pervasive impact on mental health at a global level. What if, in addition to tackling mental health with the strategies I've already described, we focused on addressing broader systemic factors that influence mental health? Social programs at the state and federal level can help people to access physiological needs, like food, water, shelter, and affordable medical care, all of which are crucial to maintaining stable mental health over time. Investing in third spaces in which members of a community can come together could help to increase interpersonal connection and decrease loneliness. Anything we can do to improve quality of life in other domains will concurrently improve mental health. You may be thinking, Yaerin, your pyramid still has a bite eaten out of the bottom of it. I saved this piece until the end because it holds a special place in my heart. All of these bigger societal changes happen when individuals take action. Please know that you matter. What you do matters. What you say matters. Ultimately, I have made it this far because of countless individuals who have touched my life in big ways and small. From my family, friends, mentors, and healthcare team, who have been with me for every step of my journey, to a kind stranger who shared her umbrella with me at the bus stop on a miserable, rainy day. I owe my continued resilience to the kindness of those around me. Your voice and and your presence are so important. Have conversations about mental health with the people you care about. Share your thoughts, your time, and your talents with the communities around you. Advocate for and vote for policies you believe in. And above all, I beg of you, be kind to yourself and to others, because you truly never know whose life you might brighten, change, or outright save with what you consider to be the smallest and most trivial of acts. Right now, 1 in every 2 people are expected to experience significant challenges to their well-being. By tackling these challenges at all levels of society, we give ourselves a fighting chance. I am firmly invested in the belief that the future of mental health will shift radically as we put our heads and our hearts together. Thank you.